we see from a health perspective is the fact that women may find out their HIV status, but are afraid to come forward for care, support, and treatment because they don't want to end up in the criminal justice system. We also see women not testing for HIV, once again, because they don't want to end up in the criminal justice system. Black women are very aware of how Black communities in particular are being criminalized around HIV. So they don't want to be associated with it. So they would forgo accessing treatment, i.e. testing, that would lead them to treatment, because they don't want to be criminalized. We also have a situation where Canada is the only country that has actually prosecuted a woman for transmitting HIV to her child. So this, once again, elevates the fear level for women, particularly when so many are finding out about their HIV status during prenatal testing and screening. And so it becomes now part of how we provide treatment and care for our clients. We have to engage them with very early conversations about what the law means in Canada, what potentially you could be charged with, how it potentially could be used to abuse you, and this now becomes part of healthcare. And I think that's a very sad state of affairs. People may be diagnosed, they may be seeking care from their specialist, and that will be it. Because for me to then now disclose to a family doctor, now disclose to other healthcare providers, other professionals, we have cases where women won't access their benefits plan at work because they don't want their employer to know that they're HIV positive. It all plays into the stigma and this fear of criminalization, where I will seek the most limited amount of treatment, support, and care possible to avoid anyone understanding the nature of me living with HIV. And people are going to great lengths as well to not have to disclose to family. So the hiding of medication or not taking medication consistently because they don't want people to know about their status, particularly women who are in violent situations or with precarious immigration status. It is part of our responsibility to engage in effective advocacy to eliminate HIV criminalization from the legal system. I don't think that we can actually say we're HIV advocates and activists if we're not doing that work. When we can see the impact that it's having on people going for testing, for people effectively staying on treatment, and for keeping people safe. For HIV positive women, 40% report in Canadian studies experiencing sexual violence. And they are 4 times more likely also to become HIV infected because of sexual violence. I'm not seeing prosecution of the sexual violence that they experience at the same level that I'm seeing prosecution for people living with HIV and not disclosing their status. So there's an imbalance. There's definitely a gender imbalance here that has to be addressed. And as an organization serving women and HIV positive women, we have to engage in any kind of advocacy that is going to change that dynamic.